Hey you guys, welcome back to my channel. If you guys are new, thank you for tuning in to my channel. And if you guys are returning, thank you as well. I mean, it has been a long journey throughout this entire process of nursing school. And I am finally thankful to say that I am almost 90% done. And I am so excited to be saying that because, as you guys know, I mean, literally, when you first start nursing school, you think it's going to drag, you think it's going to be forever, and it's going to linger, and it's going to be long. And that's what all of us think, I think, when we first start nursing school. But I am excited to say that I am almost done. I am currently now in Med-Surg 2, which is really a continuation from Med-Surg 1. But it's a little bit more intense, and we do have clinicals with that class. And I am also now in OB and Peds. So we're learning about infants, kids, children's, mommies that's pregnant, after they have the baby. I mean, all of that good stuff. We are learning everything in OB. In this video, I am really just giving you guys an update as to what's been kind of going on with me. I passed Med-Surg 1, and I also passed mental health, which was no surprise. I knew I would get it done, but you guys know how it is. I mean, if you're in nursing school, you know how it is. You know, you stress out about finals and about passing and about getting a good grade. And I mean, it was crazy last semester. And in all honesty, I mean, I hated mental health. I really didn't like mental health. I know I needed it to get to where I needed to be. So yes, I did pass the class. Med-Surg 1, I loved Med-Surg 1. That was the class that I actually loved. I'm currently working in adults. If you guys have been watching my previous videos, you know that I'm a medical assistant currently, and I work in an adult clinic. But my whole career, it's pretty much been an adult. So everything kind of come easy when it comes to being and learning and just knowing many different diseases, disorders, signs and symptoms, what goes with which conditions. I mean, that's just all come easy to me because I'm an adult. So my whole career has been an adult. So it was really easy in that class, and I love the teacher. But mental health was a whole different situation. I knew I didn't want to be a mental health nurse. I mean, so I was there to learn, but I just don't feel as I was that more motivated to be in mental health, because it wasn't for me. It wasn't for me. I knew it wasn't for me before I got into that class, and I knew it wasn't for me when I was in the class. I mean, it is what it is. I think we all are going to have those different preferences, and if you guys have been watching my previous videos, you know that I have been actually waiting on this semester that I am in right now to get into OB and pediatrics, and I am actually really excited. I've learned so much thus far just being in OB and pediatrics, literally. I mean, I am like really excited because I just feel like everything is kind of correlating together. I mean, what you see is what you get in OB and pediatrics, and that's what I like. Everything is correlating together. What I'm learning in clinicals is also what I am learning in the classroom. So everything is kind of going hand to hand when it comes to me learning and processing everything. And I'm glad because, like I said, you guys, if you've been watching my videos, you know I want to be a pediatric nurse, well, more specifically a NICU nurse. But if I had to do OB, or I don't even really want to say postpartum, I'm going to talk to you guys about that later on. But yeah, the whole process of me just learning in OB has really been good. Med-Surg 2 has really been going wonderful as well. We have clinicals with that class too, and I felt like clinicals on my first day was amazing. I'm going to try to get more footage of me actually going to clinicals. I mean, you guys know I can't really take videos on the floor because of HIPAA and just patient confidentiality, but I will try to at least get a little bit of video time in for you guys so you can see exactly where I am, or like I can probably talk to you guys while I'm at clinicals to let you know specifically what I either learned for that day or what I saw for that day. But I'm going to talk to you about it right now. In Med-Surg 2, we went to a clinical site that was not that far from where I live. It was about 15-20 minutes, which isn't that far, because our OB and Peds are an hour away. So it just has been crazy with that location. I mean, we've been there before. With Med-Surg 1, we were at that same clinical site, but it's really far, and mainly all of us live in the area that I live, so it's just really far, but it was good experience. So with Med-Surg 2, I feel like we saw a good amount for our first day. We were taking vitals, checking blood sugars. We got our patients for our care plans. We hang fluids. We actually saw someone that had a bladder flush, and then we actually saw someone that had a nephrostomy tube. And that is just when they make an incision in the back where the kidneys are, and he had a direct line to his kidneys. And once they pretty much did that, it was him. He had to be on antibiotics because he had an infection in his kidneys, so they put that tube in. And that was a whole nother situation. That was so complicated, you guys, I'm telling you. Like, but we were able to see the nephrostomy tube itself, and the nurse actually take it out. So that was a good experience, I feel like, because I had ever seen that before. So that was something nice and good to see. I mean, obviously not good for the patient, but it was good for us to actually be able to see and assist with that as well, because she did have to cut a couple of stitches in order to take it out. So I felt like that was very exciting. So those were like two different things that we actually saw. We were paired with a great LPN. She was wonderful. She wanted to teach us. She loved being there. We wanted to be there. And it was also a medication that, I was like, oh yeah, it's for this. And we were just being proactive, and she knew that we wanted to be there. So she knew, and she was like, hey, you guys are going to be really good nurses. And I'm like, yeah, we are. Because we were paired up together. Well, I was paired up together with someone else, but I'm like, yeah. So she knew that we wanted to actually be there and learn, and that was really, really, really good. So that was for Med-Surg 2. We were actually able to get a little bit of lunch in between, and then go back up and assist with a couple other things, but nothing really too exciting. But I do feel like for our first day, that was wonderful. That was great. But for OB, on the other hand, now you guys know I love OB. Like I'm like all for pediatrics and NICU and labor and delivery and postpartum. I mean, like, we had a wonderful time, and everything that we learned in on the floor at the hospital, it was in the book. The teacher taught us, and I felt like I was prepared and more ready when I got to OB. I mean, OB clinicals. It was really great. We also rotate at this clinical site. We rotated at both, to be honest, because they never want to put us in the same exact unit or the same exact floor. So we rotated between different floors and different units. So for Med-Surg 2, one person went into the ER. We were on the Med-Surg floor, and I believe someone else went to ICU. So that was a really good experience. OB, on the other hand, I went to NICU, that I love. I went to NICU, and a couple people went to labor and delivery, and the rest went to postpartum. I thought I wanted to be a postpartum nurse, but nothing is wrong with being a postpartum nurse. Let me just throw that out there before I give my own personal reason as to why I don't want to be a postpartum nurse. But it was very slow. The most excitement that I had in postpartum was a patient. She had a spinal headache because of the epidural from the delivery for her baby. So that was like the most excitement that I had. I mean, other than that, we did vitals, and I mean, that was really it. We didn't really get to do too much of anything else. I mean, besides that, I mean, we did check a female's fundus, which is in her uterus. We did get to check that. just to get a feel of how it feels when you touch and palpate there, which is on your abdomen. So we palpated her abdomen. We were able to feel her fundus, and and we actually, I mean, we that was something that was exciting for me, and also I got to see a nurse do an assessment on a baby. So we did get to see that. That was also exciting as well. But other than that, I mean, we kind of got done early, and then we were waiting on the nurses, and I mean, we really was able to get some stuff done, but entirely, I mean, it was a kind of slow paced environment for me. And NICU, I don't think is any. It's really chill in NICU, should I say? Like, it's really chill, but the babies are really critical. So although it's really quiet, I don't want to say it's chill. It's really quiet in NICU because the babies, because they're so premature, they can't handle loud noises, banging, and lights, and this and that. So you can't really be loud in NICU. And I'm a very talkative person. I am very talkative. I'm talkative. I'm a little loud when I get passionate. I mean, like, all of that. Like, so I feel like NICU would be a great fit because I mean, in a sense of taking care of critical babies, because I'm so loving, so caring. I feel like I connect more with mothers and babies, or maybe labor and delivery. I mean, I'm really more so set on NICU, but if I had to do or started out in labor and delivery, honestly, I really wouldn't mind it either. I'm a new nurse. You kind of have to, be more flexible with what department or unit that you want to go in. I mean, everything isn't always going to be sunshine and rainbows and, oh, I'm going to go in the unit that I want to go in, and I'm going to, make the money that I want to make. You don't always get those options when you're a new nurse. You kind of got to roll with the punches. You kind of got to roll with the punches when, in a sense of getting, what you can kind of take at the moment. But I'm actually working towards being a new nurse in the NICU. So we'll see how that goes. I mean, obviously, I'm going to let you guys know, update you guys, but I am working towards that actually, to become a NICU nurse, new grad. So we'll see how that goes. But overall, I mean, and our clinical teacher is wonderful. So our clinical teachers and our classroom teachers normally work hand in hand. If you guys are in nursing school or are already RNs, you guys know that they work hand in hand majority of the time. And you learn, they try to have you learn what you are actually learning in the classroom. They try to have you learn in clinical, so it can kind of correspond. And they have actually really been doing a good job with correlating what we're going to be learning in the classroom and what we're going to be learning in the actual clinical site. So it's been really, really great. I've learned so much in NICU. Like, the nurse I had was great. She was wonderful. I mean, I learned about TPN for pediatrics for NICU preemie babies. It's total parental nutrition, which is, it has all the vitamins, pretty much calcium, you have protein, you have everything, all of the vitamins that baby needs in order for them to gain weight, and so on and so forth. So I learned about that. I mean, the majority of the babies had nasogastric tubes, which is a tube that go from it starts in your nose and it goes down to your stomach so that they can get feedings that way. I mean, let me see, what else did I know? Because we had like totally different cases. We had 3 different babies. I also just got the feel of just being a nurse entirely in the NICU. And I mean, just from her going from one baby to the next baby to the next baby, and all 3 different cases, well, the cases that were differently, it just really made me understand and realize that you have to critically think. Like, every patient is going to always be the same. Every baby isn't always going to be the same. And it made me really just look at things a lot differently. Every baby didn't have a nasogastric tube. I mean, even when I got there, I'm not sure how long the babies have actually been there, but every baby didn't have a gastric tube, because we had one baby that actually was about to be discharged. So he didn't have one. I'm not sure if they had taken it out, but he was actually about to be discharged. He was actually good to go, but one baby was more critical, was under phototherapy. And I mean, had the whole works, the whole 9 yards. I mean, he was so small that literally they didn't even need to use a machine in order to feed him. I mean, they literally just like fed him off of gravity. His feedings were a lot smaller. And I mean, it was great. It was a great experience for me. I mean, I actually got to listen to heart sounds on the babies and bowel sounds on the babies, and she was explaining to me pretty much what am I looking for, where I place everything at. And I mean, even when she was feeding one baby, she was just like, hey, if you have any questions, if you have any concerns, if you want to ask me anything, you can. I'm here to help you. And she was just really, really great. And she had been in the NICU, I believe she said, for about 30, 40 years. So she has been there for a long time. She was actually willing to help me in any way that she can. So clinical was great. I love clinicals. And I mean, because it's OB, I love it even more. And everything was really, really, really wonderful. I mean, I really have no complaints about Med-Surg 2. I have no complaints about OB and Peds. I really have no complaints at all because everything has just been going really, really great. And now I'm just really going to be preparing for the NCLEX. We have one more semester. And now it's time for me just to do what I have to do. Any additional resources that I'm going to be purchasing, I'm just going to go ahead and start doing that now so I can just get myself prepared. But if you guys have any questions for me, or if you guys want to ask me anything, please comment below. If you guys want to let me know anything, if you guys are in nursing school, if you guys just graduated, comment below and let me know. I would love to hear about other people's nursing journey, because everybody's nursing journey is different. No one is the same. And I love just all the feedback entirely. But thank you guys so much for watching my video. And as always, I will see you guys in the next one.